the Maria Holder Diabetes Center. If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Wednesday! You know it's Wednesday already, and you know what happens every Wednesday afternoon at 100.7 QFM. It's time for 15 diabetic-friendly minutes, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center.
I know that name. Where you hear that name from? I feel I hear that name already.
That's because if you are diabetic or pre-diabetic, you should know the Maria Holder Diabetes Center, located in Warren, St. Michael, right behind Eunice Gibson Polyclinic, is a place that you should be visiting often. Whether it's to get your eye screen for diabetic retinopathy, that should be an annual event once you are diabetic. Christmas comes once a year, Kaduma comes once a year, getting your eye screen for diabetic retinopathy comes once a year too. Q in the community does come once a week, but fortunately, you don't have to get your eye screen once a week. You going to Q tomorrow? Good. I see a lot of hands. Well, I hope that you're visiting the Maria Holder Diabetes Center often and looking after your health the same way too. And speaking of looking after your health, one way of looking after your health is to watch what you eat. What did you eat for lunch just now? Was it healthy? How did you know what you eat did not raise your blood pressure? That is why the Maria Holder Diabetes Center has a dietitian on staff, Victoria Cox, a very nice lady, to help guide you in eating healthy. If you are diabetic or pre-diabetic or you don't want to be diabetic, you should call and make an appointment to see Victoria. She can answer any questions about food that you might have. For example, sweet potato or English potato? Which one is better? You ever wonder about that? You want to know the answer to that, right? So let me discuss it now on QFM. So let's listen to this skit and hear what Victoria Cox has to say about that.
I have a question for nutritionist Victoria Cox. Sometimes I wake up in the morning and I just feel like eating a piece of sweet potato, and I just cook it and I just eat real sweet. And sometimes I wake up and say, you know what, I feel like eating some English potato today, and that is what I just cook. But I was wondering, what is the difference between sweet potato and English potato, and which one better for you, especially if you're diabetic?
Would be the difference between a sweet potato and what we tend to call English or Irish potato. So here I've got a sweet potato and an English potato. Sweet potato is a little bit bigger, but we're going to pretend they're about the same size. And like I said, what I want you to remember is that all carbohydrates are going to end up as sugar one way or the other. So it's not to say that, one of these has a lot more carbohydrate or starch in it than the other. They're both complex carbohydrates or starches. With that said, I'm sure many of you have heard before that sweet potato is better for you than English potato, and English potato tends to spike up your blood sugars. And the reason that you might see that actually is often the case is because sweet potato has a lower glycemic index than English potato, which is kind of ironic considering it's a sweet potato. So therefore, we tend to encourage people to choose sweet potato when they are able to do so instead of the English or Irish potato. So again, it's a case of if I eat equal amounts either of a sweet potato or an English potato, so the same amount of starch in theory, I might still notice that after I eat the sweet potato, my blood sugar doesn't go quite as high, whereas when I eat the English potato, my blood sugar seems more inclined to want to spike upwards. So, like I said, it's sort of a stepwise system. My first thing that I would want to encourage someone to know is that, have an understanding that both of these are carbohydrates or starches, both will end up as sugar in the end. However, if you then, I could either have the English potato or I could have the sweet potato because I have them both available to me, then you would know based on the glycemic index knowledge that you're gaining that the sweet potato is going to be the more preferable option. However, let me remind you again that just because the sweet potato might be the better choice, it does not mean that we can eat unlimited amounts of sweet potato. This is an important distinction to make. When we say that something is healthier, it doesn't mean that we can eat endless amounts of it and not expect our blood sugars to go up. I mean, if we still ate a massive portion of sweet potato, you can be sure that we would expect to see a big increase in our blood sugar, because like I said, ultimately, both of these get metabolized into glucose. But this one is going to do it much more rapidly and kind of cause that spike and fluctuation we want to avoid.
Did you all hear Victoria Cox? I will repeat it again, but you should have been listening. It is okay to eat sweet potato, but don't eat excessive amounts of it. In fact, don't eat excessive amounts of anything. Remember, you can call 417-0305 and make an appointment to get a personal eating plan from Victoria. And that same number, you can also make an appointment to see podiatrist Louise Robinson to get your feet looked at. Remember last time on this show we talked about orthotics and what are orthotics? You don't remember that? Alright, I can play it again for you. Tell him again, Louise.
So you may also hear the term podiatrists use called orthotics. And what orthotics are custom-made devices that we put in shoes designed to help support and improve the function of the foot and ankle. And this can correct abnormal walking patterns such as gait, also can alleviate pain and improve overall foot and ankle health.
Good. So that's a reminder on what are orthotics. So sometimes you might be in the supermarket shopping or in certain stores and you might see orthotics on sale and you might be saying, why should I get special orthotics made for my foot when I can just buy the ones in the supermarket and they're cheaper too? Louise answers that question.
So you can see in a lot of supermarkets over the counter or in pharmacies promoting more affordable orthotics. However, they don't supply the same level and support as if a podiatrist has actually made them for you. So when we actually make the orthotic, it is designed for the individual and is crafted just for your specific needs to help with your individual foot and helping you walk.
Thank you, Louise. So that's why you should see Louise at the Maria Orla Diabetes Center and get proper orthotics to help you walk properly, to help you walk good when you're going to queue in the community or doing your line dancing and thing. As we walk into our Q song of the day, and it's a walking song, Dionne Warwick from 1964, the year after I was born, just when I was learning to walk. This is Dionne Warwick with Walk On By. Compliments the Maria Holder Diabetes Center.
The Maria Holder Diabetes Center.
If you see me walking down the street and I start to cry each time we meet, walk on by, walk on by. Make believe that you don't see the tears, just let me grieve in private, 'cause each time I see you I break down and cry.
So when we actually make the orthotic, it is designed for the individual and is crafted just for your specific needs to help with your individual foot and helping you walk.
The Maria Holder Diabetes Center.
I just can't get over losing you, and so if I see you broken and blue, walk on by, walk on by. Foolish pride, that's all that I have left, so let me hide the tears and the sadness you gave me when you said goodbye. Oh, walk on by.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
We now welcome a patient of the Maria Holder Diabetes Center, Mr. Paul Edwards. How long have you had diabetes and what challenges have you encountered with the condition?
I had diabetes since 2009, and it wasn't when I was working permanently in Barbados. It was when I was working in Grand Prix motor racing, where my driver saw me a little bit woozy when I got off of the plane, and he was a diabetic himself, and he tested me, and I was 22.
Wow.
Blood count. So I was well over. So from that moment onwards, I knew I had a problem. I've been a patient of Maria Holder Diabetic Center for probably about 7 years now, since I've lived permanently in Barbados. And I've worked as a chef and in several restaurants in Barbados. But to be fair, I've known Miss Brathwaite, Diane, I've been under her care for this period. And I must tell you that she's been extremely helpful to me and probably saved my toes at least 3 or 4 times in the last few years. From my point of view, I've referred, and Diane has met many of my, probably 2 or 3 colleagues that have had diabetes, and they've also become firm patients of Maria Holder Center.
In terms of you personally, how did diabetes impact your lifestyle?
Tremendously. When I first discovered in 2009, when I told you that, the first situation for me was having a reading of 22, I was referred to a doctor in Melbourne in Australia, and when I came back to Barbados, which is my place of residence, I immediately contacted Dr. Brown, who referred me to the Diabetic Center, to Diane, obviously just straight away. It impacted me in the way of, I was suffering with my feet terribly, high blood pressure always, not listening to Diane Brathwaite always, because she calls me her bad boy, because she just wonders how I survive. But to cut a long story short, I couldn't have done without them. Even when, the going was tough, Diane helped us with some, medicines and made sure that we all got, what we needed to keep going and, to control our diabetes. This facility is top notch. But the long and short of it is, Barbados for many, many years has been known, and sadly, I'm sure that this reputation is getting a lot better. It's always been known as the amputation capital of the world, which is really sad. But with the help of everybody that works at the Diabetic Center, I think we've kind of moved a little bit forward from that now, because you can get help, and I would advise anybody in Barbados who just thinks they may be a diabetic to go to the Diabetic Center. I have nothing but high praise for it.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.